So today, we're going to start in an airport, fly across the Pacific, and then to Mars and back. Have you ever been stranded in an airport overnight? I have. I remember I was on a way to present at a national conference, and our flight got delayed because of some weather issues. I ended up sleeping at Portland Airport overnight. I remember it was bright, it was cold, I was freezing, I was hungry. All the kiosks in the airport were closed because it was late night. There were people rushing by. I remember holding and clutching my belongings tightly because I was worried that someone was going to take my stuff because I was out in the open. It was a pretty rough night, and especially trying to prepare for a presentation, I wanted to get some rest, but I couldn't get any rest that night. I want you to take that situation and imagine it 1,000 times worse. I want you to replace the chaos and stress of an airport with the chaos and stress of someone that is living out on the streets. I want you to meet Mr. Jones. Mr. Jones not only lives on the street, but he has to deal with chronic mental health and medical conditions. He has diabetes and congestive heart failure. His ejection fraction is only 15%, which means his heart only pumps 15%. He has multiple medications for his diabetes and hypertension. Living on the street, his bags get stolen frequently, and he misses out on taking medications, resulting in frequent trips by EMS to the hospital systems. He also ends up interacting frequently with the law enforcement because he's on a fluid pill and has to pee outside sometimes because the fluid pills make him urinate frequently. Unfortunately, this is a common scenario for people like Mr. Jones, who we call familiar faces. Mr. Jones gets a cold, and because of his experiences with the health systems, he feels like a burden. Every time he goes to the ER, people roll their eyes at him and shrug their shoulders. So he doesn't want to seek care after getting a cold and a cough and having a fever. He self-medicates, and over time his symptoms get worse and worse. Mr. Jones ends up collapsing on the street corner and is picked up by EMS and taken to the local ER. There he is diagnosed with a lung infection, and his white count is elevated, his heart rate is elevated, he has a fever, he is diagnosed with sepsis, which is a severe infection. So much so that he needed to be intubated and admitted to the ICU. The sad part for Mr. Jones is that after discharge from the hospital, he will need a placement in a skilled nursing facility for rehabilitation to get him back on his feet to be discharged home. Unfortunately, he will not have access to a SNF because of his history of homelessness, because he doesn't have a safe discharge plan from the SNF. So sticking with air travel, who here has ever been on a 15-hour flight or practiced medicine at 40,000 feet? I want to share a story with you of something that happened recently. I was on the way from Brisbane to Vancouver over the Pacific Ocean. In the middle of the flight, I was getting situated. I took my shoes off and I was getting comfortable. My glasses broke, so I was deciding to take a selfie when I heard the overhead page for is there a doctor on board? I looked around, didn't see anyone getting up to go, and so decided to respond to help. Slid my shoes back on and walked to the flight attendant, let her know I was a physician. We went a few seats back, and there was a gentleman with severe abdominal pain, which is lower belly pain, and he was writhing and rolling in pain. We took him to the back of the aircraft and laid him down. On examination and history, in the midst of that, the flight attendant came back from the cockpit and told me that we had 30 minutes to decide whether to divert the plane to Hawaii because we had to make a decision before the 30 minutes was up. Based on history, physical exam, and shared decision-making, we decided that if we could get his pain under control, we wouldn't have to divert the flight. And so we gave him an injectable medication, his pain subsided, and we passed that point and were able to continue on with our flight. But being careful, I continued to walk back and forth to check on him, check his vitals regularly. And one of the times I was sitting back there, I started to walk back to my seat, and the flight attendant caught me again and said, "Hey, in my 25 years of air travel, I've never had 2 emergencies on the same plane. Can you help me with someone else?" So I walked up with her to a young lady who was suffering from a post-pregnancy surgical complication that required significant help. She needed IV fluids, and when we were looking back at the med kit, we saw that we had normal saline, 2 bags. We had IV tubing and an IV cannula. So we were excited that we could help her and provide this treatment. But in setting everything up, we realized that we were missing a 50-cent connector that would have connected the tubing to the cannula. Luckily, we were able to lay her down in business class and, using other means, stabilize her. And thankfully, we were able to get both of them to the ground and, at our destination, handed them off to EMS. That was such a relief. I know what you're all thinking. What does this have to do with our Familiar Faces project? So our team and our systems deal with complex situations with limited resources all the time, where patients have unique needs, just like these 2 patients on the plane, that require specific interventions. And we can't generalize and treat them as a whole. Our team consists of physicians, pharmacists, social worker, and mental health professionals. Our definition of a familiar face is someone that interacts with EMS, hospital systems, mental health facilities, criminal justice system, and homeless services on a regular basis. We can fly drones on Mars. Why is this so difficult? We can use a remote control on Earth and communicate with systems on a different planet. But our systems here in the healthcare don't actually communicate well with each other. That was one of the biggest barriers that we found when our team was exploring this problem. So in order to try to solve this, we're working with community stakeholders, local government systems to build an integrated IT system to help connect systems to provide information to frontline responders to be able to take care of patients on the ground and provide individualized treatment for these folks. We are working with the county to provide a bridge housing facility for folks to have a place that's safe and trauma-informed to heal. We're working to create sustainability in terms of providing hot, healthy meals, not only for people to have food, but also to eat healthy, to build their immune systems and help them recover quickly from health issues. The other thing that's the most important is creating a team of familiar faces for these so-called familiar faces so that they can help navigate them through the system. Lots of times we look at all the systems we have in place, and it's interesting. We have a lot of different cogs, a lot of different wheels that tend to work in parallel. Imagine a reality where we could get those cogs and wheels to work together and come up with a Swiss watch. Join us in creating a reality where someone like Mr. Jones has access to a team of individuals that are familiar faces to him to help him navigate a system that is very difficult to navigate. Help us to provide hot, healthy meals to people like Mr. Jones, as well as being able to identify him early to prevent problems. Help us create a reality where a human connection and $4 could save significant suffering and tens of thousands of dollars like the ICU admission that we had for Mr. Jones. Lastly, I want to close with something that a quote a friend of mine quoted regularly. She said, "In a world where you can be anything, be kind." Blue was one of the most resilient people that I've ever met. She has been through tremendous adversities, trauma in childhood, trauma living on the streets, living in a tent in the woods, and also through addiction. Tragically, we lost Blue to the same miscommunications, stigma, and uncoordinated systems that she was trying to help us save. She was a trusted member of our team, and we miss her dearly. I want to end by letting you hear from her herself.
They knew my name. The second I walked into this building, they knew who Blue was, and that was important. Like when you walk by somebody and you're like, "Hey, it's good to see you," and you just keep going, that's dehumanizing whether you realize it or not, because now you haven't stopped to say, "Hey, this is who I am, and I'm sorry you're in this situation. I don't have anything to give you, but I have a heart, and I have ears. Do you want to talk for a minute?" Like, that means so much more than anything monetarily you could give somebody. Rehumanizing them is a big deal.